And Massachusetts will not be following 4 other states implementing mandatory Ebola quarantines. 22 News State House reporter Tiffany Chan is live in Boston with whether state lawmakers agree with that call.
Governor Patrick said this morning that mandatory Ebola quarantines are not needed in Massachusetts, instead opting to follow CDC guidelines.
It's a new measure that's drawing some criticism. New York, New Jersey, Florida, and Illinois are now enforcing mandatory quarantines for people who work directly with Ebola patients in West Africa. Massachusetts Governor Deval Patrick said a quarantine plan is not needed, but state lawmakers on both sides of the aisle disagree.
It's important that we not overreact, but it's equally important that we not say something like a quarantine can't be used or won't be used when in fact it could be an effective tool to be able to prevent the spread of the disease.
This after a nurse was placed under mandatory quarantine in New Jersey after treating Ebola patients in Sierra Leone, despite showing no symptoms. She has since been discharged. Governor Patrick said Massachusetts will follow the guidelines set by the Centers for Disease Control, only placing travelers under quarantine if they present Ebola-like symptoms. I spoke with State Representative John Vilas, who sits on the Committee on Public Health. He told me that the state needs to keep all options open because Ebola is a new virus and the risks aren't fully known.
We have to think outside the box right now, whether it's entertaining travel restrictions, travel bans, or these temporary quarantines. We cannot allow this to present itself in Massachusetts.
Ebola is not an airborne virus. It's spread through an infected patient's bodily fluids only if a patient is showing symptoms, such as a fever.
There are currently no confirmed cases of Ebola here in Massachusetts. Governor Patrick maintains that the possibility of Ebola coming here are still very, very low. Reporting live at the State House in Boston, Tiffany Chan, 22 News.